TEL 410, Leadership and Advocacy in Educational Endeavors. Reflection on community advocacy work. Background. Background information. I gained background information by talking to parents, teachers, school aides, friends, neighbors, and family about what they knew about services for mental health for young children in the Chandler School District. I researched what was available for mental health support in Arizona and Chandler District. I was able to identify several agencies and programs that provide services for mental health of the young child. There were a variety of services depending on the family qualifications, socioeconomic status, child needs, and a medical diagnosis. I researched school budget online, President Trump's education budget for 2018, classroom spending for supplies and faculty, and learned about the academic situation that Arizona is currently in. This is significant to understand the culture of support and awareness for the needs of the developing child, and understanding what we're addressing and the recent history of the situation. I discovered that nationally, 8% of young children have a disability. In the Chandler Unified School District, that number is 11% of the school district has a disability, and there's about 43,000 students. Action plan. Action plan is to develop and demonstrate a teaching tool that will educate and train on mental health with a focus on social and emotional development and support in conflict strategies for the young child in the Chandler Unified School District. My intent for this training is to be available to those who have the greatest impact on the child, focusing on teachers, caregivers, and parents. My advocacy focus statement, my focus concerns, and my goals are all supportive of my action plan. The action plan has 4 steps. It was to educate myself as to what was available, what is wanted, what is realistically usable for the intended user. To develop a support platform, which is, to me, is really important. 3, recognize advocacy programs that support the community already and draw those in and recognize them. 4th was to educate the community to a new, more accurate understanding of mental health advocacy agencies and support systems. In this, leadership style was really something that I identified with. I believe that the personal core value system of the leader works with the essential primary characteristics of servant leadership, with listening and empathy, hearing or healing, awareness, persuasion, conceptualization, foresight, stewardship, commitment to growth of the people, of the community. I think it is advantageous of the leader to be aware of different styles, depending upon the environment and the team that they are working with. For myself, transformational leadership, utilizing a platform that all members of the network for the child can work together. As a community, you rise together and you mentor and you create a wave of movement of support. Some agencies that I worked with and talked to frequently were Quality First, First Things First, Smart Support, Association for Supportive Child Care, Family Life Consulting, and they're part of Intel's private network. Spoke with several parents. One parent was very, very vocal on how she felt about it, and I referenced her twice in my research. Some of the issues that I had that were really tough were gaining access to what was already available to the teachers. It was really hard to find what really teachers could get trainings on already, and I wasn't able to find breakdown of these classes for the continuing education hours. Second, I had an issue with some software, trying to create it, trying to find something nicer than what PowerPoint could do. Third, I was looking at educators and caregivers that had hands-on experience, which were doing this already, and there was not that much of an interest. The interest came from parents wanting a resource, a website that had these other agencies listed, other resource agencies, other programs. They wanted an information site, was the feedback that I got from several parents. Insight statements. The advocacy soapbox assignment really helped me with trying to condense what I was thinking, feeling, and trying to say. Brevity is not a strong point for me, so this was really helpful in focusing what I was wanting to do, and then moving on to community as a practice, finding those advocacy agencies that currently are really supportive of the young child and putting services and programs in places where they can have the greatest impact. The Southwest Human Development and Smart Support and Association for Supportive Childcare are who I spotlighted. They do a lot of great work for the young child and their families. My insight awareness statements, I focused on awareness, commitment to growth, and empathy. I believe that by showing what this can do, what this has done, it'll cause a greater support system in the community for these services. And I really enjoyed the project.